Hi, my name is Dr. Anate Brauer. I am a board-certified reproductive endocrinologist at RMA of New York. The infertility journey can be a very stressful one and a daunting one, and that's why it's so important to have a holistic approach to care, which we have here at RMA of New York. Not only do you have, of course, your physician team and your clinical team, but we also have a nutritionist here on board who's really amazing, psychosocial counseling for anyone either going through a stressful time or using third-party reproduction, as well as an amazing genetic counseling department. We have two of the smartest genetic counselors I've ever encountered who can help you answer all of your questions from testing of embryos to preconceptual genetic testing. I feel very lucky to be part of a team that offers such holistic care to my patients. I really believe that it takes a village to raise an embryo, and I feel so lucky to have a clinical care team that helps me do what I do. No physician can help a patient without our team. So our care teams are composed of course, your physician who will follow you throughout your process, a nurse who every time you come in to have labs done or you come in for your monitoring appointment, which usually incorporates an ultrasound and blood work, will give you a call that same afternoon with your results and your instructions. Our nurses take extra care to also email our patients, which is oftentimes very appreciated as a more efficient route of communication. Also on our teams, we have our amazing IVF coordinators. And if you're preparing for an IVF or an egg freezing journey, they're oftentimes the first patient care team members that you will encounter. They really help set you up for your cycle, let you know what to expect. Also on our teams, we're each assigned a financial counselor. My financial counselor has been with me for 4 or 5 years now. She knows IVF so well. She knows the ins and outs of insurance. And I'm so grateful for her that she helps my patients, kind of guide my patients through the financial aspect of the journey, which can be difficult. So all of these different members of our team really work together under the guidance of the physician to give our patients the best experience possible. I truly believe that the heart of any IVF program is the IVF lab. Of course, you have to have a good doctor who you connect with on a personal level, and you want someone managing your care with responsibility and experience. But where the real magic happens is the IVF lab. I feel so grateful to have one of the best labs in the country. It's very hard to compare success rates across labs, especially in a wonderful city like New York, where there's so many amazing labs here. There's an organization called SART, S-A-R-T. There's a website, it's called sart.org, where you can actually go on and look at all clinics across the board based on age groups to look at success rates. And while this tool isn't used to compare labs, it is a great tool for patients to use to look at success rates across the board. And year after year, RMA of New York has one of the best success rates in the country. One of the favorite parts of my job is being able to call a patient after a daunting IVF cycle and tell them they're pregnant. I owe that joy wholeheartedly to our embryology lab. Our embryologists work tirelessly using the most cutting-edge technology and incredible research to offer our patients the best possible chance of success.